What is up, ladies and gentlemen, and welcome back to the Boost Your Biology podcast. Today, I'm joined in the studio with an expert in longevity science and research, and we are actually joined in the studio with the founder and CEO of Extension Health, Jonathann Kuo. Welcome to the podcast.
Hi, pleasure to be here. Excited to speak with you guys today.
Awesome, awesome. So, Jonathann, you were mentioning just before this that you are absolutely obsessed with regenerative practices. You've been dabbling within stem cells, exosomes, plasmapheresis, HBOT, and you mentioned something called the neuro reset.
Yeah,
So I'd love to learn more about your story, Jonathann. How did you become so fascinated with human longevity?
sure. Yeah. Um, I'm trained as a traditional Western doctor. I did my medical school in Boston, and I did my residency in anesthesiology here in New York at New York Presbyterian, Cornell, Columbia. Subsequently, I did an interventional pain management fellowship, and that was back in 2008. And then I started a private practice. And so here in New York City, I kind of built a very busy interventional pain management practice. And what that means here in the U.S. is that we use interventional techniques such as epidurals, nerve blocks, nerve ablations to treat chronic pain. All right, chronic pain of
Mm,
the neck, back, the joints, the spine, tendons, things like that. So I built up a very busy practice, and over 15 years, we've treated over 50,000 patients here in New York City.
wow.
This still exists. I still run it, but that's a place where traditional medicine is practiced, and traditional medicine, unfortunately, doesn't really get down to the root cause, right? Like, we're treating
Mm,
these patients year after year. Unfortunately, you give them a shot, they feel better, but 3 or 4 months later, they come back and they're still in pain, and you're like, okay, I can keep giving you these steroid injections, but deep down inside, you're not really doing them a favor. You're kind of actually probably doing harm over the long run, right? Cumulative steroid exposure. And so that really kind of led me to think further and kind of like, what can we do to really help our patients? And that
mm,
really naturally led down the path of regenerative medicine, right? Regenerative medicine, harnessing your own body's natural ability to heal.
mm,
Your body's very intelligent. Your cells, everything's very intelligent. They have a capability to heal. You just need to give them the right stimulus. And so that leads down to regenerative medicine, right? People really know that as PRP, but these days, we have exosomes, we have stem cells, we have growth factors, we have all sorts of stuff coming from the umbilical cord, the placenta. So many great techniques and biologics out there that can really make a difference.
mm.
That pivoted me into regenerative medicine around 5 or 6 years ago. I started using exosomes. I wrote some of the first published studies on the safety of using exosomes in the epidural space to kind of treat chronic pain, chronic neck pain, chronic back pain. Regenerative medicine then kind of shares the same fundamental principles as peptides. Peptides. This is a hot topic. I can kind of dive into that a little deeper. Peptides kind of lead into other physiological enhancing modalities such as hyperbaric oxygen, plasmapheresis, ozone dialysis, and some of these neuro resets that we do. Um,
Mm.
I can give you a little spiel about the neuro resets just to kind of finish off that story if you'd like.
Yeah,
Uh,
yeah. I think well, my audience has heard about some of those terms you mentioned there before. I mean, hyperbaric. We've had experts on the podcast talk about the benefits. We've had Dr. Adil Khan from
yes,
it.
yes, no doubt.
Yeah, so we love learning about my audience is obsessed with learning about like sort of some of these advanced interventions that your typical Western medicine doctor won't tap into. But it
Yeah.
sounds like you have been truly on the cusp of it all. Um, how do you go about deciphering levels of evidence for some of these interventions? Like, are you mostly going based off clinical trials, or are you just seeing what actually works in clinical practice?
Great question. I mean, as a physician, kind of, you know, at the kind of leading edge of some of these therapies, many of them don't have large scale, long term human clinical trials. Okay.
Mm,
Many of them don't have the gold standard random, double blind, placebo controlled trials. However, they do have many case reports. Many of them do have a good amount of evidence behind them. Maybe the exception to that would be some of the peptides. Okay.
yeah.
But then you also, through clinical experience, I do know what works. Okay. We've treated thousands of patients here in our longevity clinic. Like, we do kind of understand what works. And then there's the kind of theory of biological plausibility. All right. As in, if it, these procedures work on certain aspects of your physiology, you kind of know what is going to work. All right.
Mm.
Peptides are already produced in your body. We know what they already are intend to do. I don't need a big safety double-blind study on BBC 157 to tell you that that's going to work. Okay. And
Mm.
then, what I do, I think, which is a little unique, is stacking a lot of these modalities in the kind of right sequence to kind of really enhance physiology in kind of different ways. And that I feel like gives you the best results.
So, Jonathan, where do you think people get it wrong in terms of like implementing some of these protocols? Is it more so around like the dosages, the right forms, the frequency? Like, where do you think people get it wrong?
I do recommend people work with clinicians that have experience with these. Peptides are not totally innocuous. They do have side effects. Like you
Mm.
can't just go willy nilly, buy stuff off the internet and expect, great outcomes there. Getting it wrong. I mean, it's you have to really work with your body's biology and your body. Everyone has a very unique biology, so really understanding
Mm.
that, getting the baseline lab tests, getting the baseline diagnostics, the DEXA, the VO2s, like really understanding your fundamental physiology and biology is very important. And so
Mm.
from there we can kind of devise a plan based on your needs and what your biology looks like. And I think that gives you the best outcome, just a really structured, measured, careful approach to
Mm.
structuring these protocols.
In terms of like pain management, you've probably come across many different interventions over the years. You've seen the traditional, I don't know, like corticosteroids, sort of
Mhm.
immunosuppressants, things like that, or analgesics. Um, what what do you think has shifted maybe in the last 5 to 10 years in terms of the way that you approach like chronic pain?
For me, it's a big shift in regenerative medicine. Okay, I mean, steroids definitely still have their place in time. If you have something very acute and you need like very rapid anti-inflammatory, nothing beats steroid. Okay, steroids, the gold standard, quick anti-inflammatory. Um, but combining some of the biologics with steroid at times
Mm.
can yield the best kind of results. All right. So kind of depending on the injury, the chronicity, whether it's acute, chronic, how quickly someone needs to get back to action, whether they're an athlete, whether they can wait, all these things factor into the decision of the mixture and the placement of where we inject. Also, just image guidance. All right. These days we have very high resolution ultrasounds. We use X-rays. The combination of ultrasound and X-ray, you can really get a needle very precisely into any area of damage in the body. So
Mm.
regenerative medicine, image guidance, and also some of the newer techniques such as intraosseous injections, injecting directly into the bone these days. That's been shown to really help a lot more with osteoarthritis. No longer do you just do the joint, just shoot it in the joint, it's going to work. You really need to think about the entire mechanical functional structure of a body part. Okay, whether it's like the spine, it's not just treating the epidural space. You need to treat the ligaments, the facets, surrounding structures. Like you really have to think about how everything's connected in the body and thinking comprehensively about the functional unit. All right. And so
Mm.
that kind of thinking, once again, the intraosseous injections directly underneath the cartilage. If you have cartilage degeneration, you really want to get underneath that cartilage to encourage the cartilage layer to be healthier. So we're doing a lot more of those techniques for osteoarthritis, for degenerative joint conditions, and we find much better results when we do that.
Mm. Shifting gears, I guess, Jonathan, with one of the most important nerves in the human body, which is the vagus nerve. You mentioned before that you basically have some sort of therapy or modality where you're actually injecting directly into this vagus nerve. So, do you want to sort of go high level, explain to my audience what is
Yeah.
the vagus nerve and why are you targeting that specific nerve?
Sure. Yeah. So vagus nerve is the 11th cranial nerve. It's the largest nerve in our body. It is that brain gut connection. Okay. We all know how important that is. It's responsible for producing, your gut's responsible for producing a lot of your hormones. It's responsible for the immune system. A lot of the communication, the information from the body actually comes up through the vagus nerve to your brain. So, you know, vagus nerve is a hot topic these days, right? Like all the sauna, the cold plunges, the humming, all the things, the stimulators, all those things are trying to improve your parasympathetic state, right? That rest and relaxed state. A lot of this in modern life, you're stuck in this imbalance. Your fight or flight's a little too elevated. Your rest and relax is not enough. People just can't chill out, right? Because modern day life, stress, anxiety, this and that. Um, I do a procedure called the neuro reset. It is 2 steps. We block the fight or flight state, okay, by injecting the stellate ganglion here in the neck. And then we actually go and do an injection of the vagus nerve. And so the vagus nerve is, once again, you can actually directly access that vagus nerve. It's actually visible under ultrasound. It lays right next to the carotid artery. And
Wow.
so we have been kind of playing around with injections around the vagus nerve. We have currently, like we're doing an active study looking at what are the exact effects of injecting the vagus nerve, whether you get improved HRV, improved parasympathetic function. And we do find that we do get better results when we inject the vagus nerve along with that kind of stellate ganglion block. And we call that the neuro reset, right? Taking the concepts of pain management, where when we treat peripheral nerve pain, we do a hydrodissection of the peripheral nerve. What that means is you're actually releasing a nerve from its surrounding fascia entrapment by injecting some fluid, all right? Whether that's saline, whether that's dextrose, whether that's growth factors. You can inject things around a nerve and relieve pain that way. And so if you can, kind of using that theory to inject the vagus nerve, can you make the vagus nerve function better? All right, is the question that we're trying to answer. Can you deliver some of these things that you're injecting by the vagus nerve kind of directly into the brain? That's something that is theoretical as well. So there's so many questions still left to be answered. When you search the literature, there's really only a few case reports of vagus nerve hydrodissections being done for chronic pain, actually. And there's several reports from Hong Kong that shows that, yeah, it can potentially help. We have been doing that for chronic pain as well, but we have been kind of thinking, okay, for people that have, potential vagus nerve dysfunction, potential imbalance of their rest and relax fight or flight states, can that potentially be beneficial? So
Hmm.
something I've done several, probably over close to 1,000 times at this point.
Wow.
Um,
What sort of is there a specific type of condition that it's most suited towards? Like, is it more so around, I don't know, like gut related pain, or what type of pain is it most suited towards, you think?
Yeah, I mean, great question. Any kind of time where you suspect a vagus nerve dysfunction. Now that's a little tricky because the vagus nerve dysfunction can manifest in so many different
Yeah.
ways. I think, when you think about why we do the neuro reset in the first place, that stellate ganglion block, it is for excessive fight or flight. Okay.
What's the actual it's not like a Botox. It doesn't like it's not like a Botox
No, it's actually
no.
local anesthetic. It's
Who
long-acting local
right.
anesthetic. We use like 0.5% bupivacaine. You reset the nerve fibers. You
Wow.
stop them from firing for like 4 to 6 hours. And when they come back, they fire slower. Okay, it's like
Wow.
hitting a reset button on your neurological computer. And so that procedure is useful for anxiety, PTSD,
Yeah.
sleep disorders. All right, so those are the main indications that we use for that. So many people have that. Um, Injecting the vagus nerve may help with the effects of the stellate ganglion block.
It
That's
sounds like
so far.
it does sound like it's an immediate sort of therapeutic effect instead of like some, medications interventions might take 4 to 6 weeks for onset. Sounds like it's an immediate straight away,
Correct.
basically.
Like we know whether this is going to work within, honestly, sometimes within hours. Okay, like,
Wow.
but some people wake up the next day and like, wow, I feel different. Okay, we've used it for gut related issues, chronic constipation. All right, you inject the vagus nerve, we've had relief from that. Whole bunch of different kind of
You
weird
you
maladies can arise from vagus nerve dysfunction.
you mentioned that it's you can see it right next to the carotid artery. So where exactly is the injection site?
It is usually done by C5, C6, C6, C7, ultrasound guidance. It's this little dot that lives right next to the carotid artery. So you stick a needle under guidance right next to the carotid artery and you gently tease out the vagus nerve using fluid. Okay. What we
Wow.
typically use is a combination of dextrose, like D5 water, and I've been using a whole combination of peptides. I've used exosomes. We use exosomes quite a bit here. So putting exosomes out of Vegas is another thing. Like, can we use growth factors and messaging signals to improve the health and resilience of the vagus nerve.
Mm. What sort of complementary peptides would you stack onto some sort of protocol to help with the parasympathetic response? Are there any specifically that you've leveraged in that regard?
It's tough to say that they specifically help with a parasympathetic response,
Yeah.
okay? But we
Yeah.
do have peptides that help with kind of anxiety and maybe the sympathetic response, okay? One of those is called C-Lank, SELANK. That's a peptide that we love using as an
Mm.
anxiolytic. It's not habit forming. It's pretty easy to use. We have it as a nasal spray. I like combining that with something called P2228, which is good for mood stabilization. So we have that as a nasal spray here that we use for patients.
Mm.
CMAS, another one, is a nootropic. It's more for like cognitive improvement. Does that necessarily help the parasympathetic state? Maybe, maybe not. Then there's also just the simple kind of basic anti-inflammatories like your BPC 157, TB 500, the KPV, just being anti-inflammatory. A lot of like mood disorders, psychiatric disorders, depression, anxiety can actually be linked to brain inflammation. Okay, so if
Mm.
you can decrease neuroinflammation, you can actually make improvements in someone's like mood, anxiety, stuff like that. So
Yeah. I think a lot of people are often led to believe that mood disorders such as anxiety, depression, or mental health conditions are always driven by just neurotransmitter deficiencies. But what you're saying here is that like a core driver behind the manifestation of these symptoms could be related to just oxidative stress and inflammation, right?
correct, correct, correct.
Mm.
Yeah, things that help with oxidative stress and inflammation in the brain also have been shown at least in clinical experience to help with mood. All right, so
Mm.
things like hyperbaric is definitely helpful for PTSD, right? You've seen it helpful for anxiety and depression as well. And then the GLP-1s, okay? GLP-1s just what it's been published like this helps with mood, all right, by decreasing inflammation. It's just a
Mm.
pretty logical, simple mechanism there.
Have you kept your eye on or I don't know if if you're allowed to administer it, the retatrutide, or
Yes, yes, I have, and I have a good amount of experience with that. I find that
mm.
a really great, novel triple agonist that works better than tirzepatide. You need lower dosages to kind of get better responses. You have less side effects. The triple agonist, the triple receptor mechanism is great. And then there's also the fourth and fifth generation stuff coming out. I kind of have knowledge of all those things that and have spoken to the people that kind of are developing that. So very
Mm.
exciting things to come. Yeah, very
Well,
exciting.
when I was actually the other day, I was researching understanding the mechanism of that retatrutide and the
Mm-hmm.
glucagon agonism aspect. So
Mm-hmm.
that's what obviously one of its mechanisms.
Mm-hmm.
I was confused to understand how does that actually help with like fat loss and or glucose stability, because it's like why would a glucagon agonist actually help? I mean, I think it mobilizes. Does it mobilize glycogen? Like I was trying to understand the mechanism.
Yeah, I mean, glucagon receptor agonism and retatrutide activates the same signaling pathways as your endogenous glucagon, and so it stimulates hepatic glycogenesis,
Right.
gluconeogenesis. It raises your blood glucose levels, but it promotes lipolysis and increased energy expenditure, um, which is believed to contribute to its weight loss effects. It
Mm,
suppresses fatty acid synthesis and enhancement of fat breakdown in the liver
mm,
and your fat tissue. So I think that's how it works, right? I mean,
mm,
it's kind of balanced by simultaneous GLP-1 and GIP receptor activation. So that triple kind of receptor um, agonism is going to yield better results than just one or two. And
mm.
then the fourth and fifth generations, like you're also going to stimulate IGF-1, and the fifth generation is, perhaps activating the working on the myostatin routes, right? The myostatin
Yeah.
routes to prevent muscle loss. And so, can you combine five receptors into one kind of peptide molecule? Yes, they're kind of being developed. Or, actually Lilly just renounced their newest kind of, monoclonal antibody is
Yeah, Bimumab or something.
Yeah, Bimumograd,
Yeah.
just like really kind of prevented a lot of muscle loss in people taking these GLPs. So
Is that one that you have obtained and I guess like I know it's very early days, but that's actually one that I think would interest like the athletic performance bodybuilding sort of.
for sure, yeah, yeah. I mean, I know I haven't used the Mumograd. It's it's Eli Lilly patented drug that's not available for compounding.
Yeah.
But, where everyone's thinking, how do you spare muscle? How do you spare muscle,
Oh
right?
yeah.
There's these monoclonal antibodies. There's myostatin activin route that you can do. There's a lot of people are looking at this, and the clinical trial results that were just recently released were pretty impressive. You
Mm.
just lost all fat, and you just kept all your muscle, and so here, there's also follistatin gene therapy, right? I mean, that's a novel kind of myostatin inhibitor that's using DNA plasma technology. I feel like that can work as well. That does
Mm.
work. Yeah,
Yeah, one of my clients, Nick Bell, he underwent follistatin
yeah,
gene therapy, and yeah, within a couple of months later, like he said, his lifts were going up in the gym. He felt a lot stronger. Recovery was better.
yeah.
Um, in terms of these interventions, Jonathan, like what's your do you have like a certain process to decipher whether or not, like, how do you know which intervention to select for your patients? How do you go about?
I
Because you
mean,
got so many great ones.
yeah, but at the same time, it just kind of I like to boil things down to the basics. Okay, like if you're typically pretty healthy, you have a lot of these people that are really just trying to optimize. Okay. If your fundamental systems are in good order, all right, what are the
Mm,
fundamental systems? Hormones, inflammation, metabolism. Very simple, right? You need to have these three kind of functioning optimally, whether you're on peptides, whether you're obviously just getting really good sleep, diet, and exercise, kind of make sure all your bases are in cover. And then, what are some of the kind of that extra 20% that you can unlock, right? Diet, sleep, and exercise and your genetics, like that's 80% of your kind of baseline health. The other 20% can be unlocked by some of these kind of novel therapeutics, whether it's the shot, whether it's plasmapheresis, whether it's EBO, whether it's stem cells, a whole bunch of things that you can do, right?
mm,
So a typical patient, we use these kind of protocols. One of them would be something like, think clean, disinfect, rejuvenate. All right. And so what could that be? Plasmapheresis, followed by a regenerative cleaning, right? Followed by disinfecting, which is ozone dialysis, this EVO thing. When you expose your blood to ozone, it basically, disinfects, right? It's like toxic to viruses, bacteria, mold, fungi, boost your mitochondria, and then afterwards you get a regenerative medicine treatment. Whether that's IV or we inject these regenerative medicine products, and then we send you to the hyperbaric chamber, right? And so this
mm,
kind of 3 or 4 stage procedure, you're kind of hitting all these aspects of physiology in
mm.
function, and you send them home with peptides. So that could be, one of the kind of typical kind of patient journeys if you're just really you're healthy, looking to optimize. There's always things that you can do to further kind of boost your biology, clean out your system, disinfect your system, boost your mitochondria, get more oxygen and blood supply to your brain. You know, all these things.
Awesome.
Yeah.
You know, you're officially the first guest that's actually seamlessly interwoven the podcast title into a sentence. You said to boost your biology. It was
There
it,
you go.
it made me so happy.
I didn't even
um,
think I just flowed.
it just happened naturally, which is even better. So we couldn't even repeat that if you tried. But Jonathan, in terms of plasmapheresis, what about it do you think makes it a useful intervention? Is it the fact that it does it help to detoxify PFAs from the body? Like what's unique and beneficial about it?
Plasmapheresis, just we physically discarding 2+ liters of plasma, and just as we age, there's certain things that our body just cannot excrete. Right? There's just some of these inflammatory proteins, like some of these cytokines, some of these immunoglobulins, like there are things that kind of are stuck in our body that we don't get rid of, and so plasmapheresis physically just gets rid of that stuff. Heavy metals, PFAS, yes. I mean, through a, basically a hemodilutional effect, you're just taking out stuff that has, your plasma, all the stuff kind of lives in your plasma, right? It lives in your kind of intracellular space and into your cells, but by the effect of hemodilution, you're going to get rid of at least a portion of that. If you do 3 sessions of plasmapheresis, you're kind of just through this process of serial hemodilution. All the stuff that's kind of stuck in your cells and your intracellular water will kind of diffuse back in your bloodstream where that plasma is being discarded. So, simple rules of physics and physiology means that yes, you will decrease your heavy metal PFAS toxin loads, and we've demonstrated that. There's simple studies, case reports that's been demonstrated in the literature.
Interesting. Yeah, I think probably the number one like influencer right now that's sort of put it on the map would have been Brian Johnson. I'm
Yeah,
pretty sure he's like, you would have had so many patients walk into the clinic being like, yeah, I heard about it through Brian Johnson, or like it might have been hyperbaric probably in the last couple of weeks or 3 weeks, probably last few months. You would have been like, I want to do hyperbaric.
yeah,
Um,
yeah.
I actually, I have a, I actually have a hyperbaric machine in my apartment,
Wonderful.
um, and it's definitely a game changer. Like I haven't been touch wood. I haven't actually been sick since, like a
Mm-hmm.
cold or a flu or anything like that.
Great.
Do you think the evidence is quite strong for hyperbaric therapy?
Yes, I certainly think so. It's been around for a little while. It's just popularity's kind of exploded recently. The science is there, the papers are there, the evidence is there. I mean, it's also pretty simple. Like, what do your cells need to function the best?
Yeah.
Lots of oxygen. You use pressure and oxygen, like you're just gonna improve your cellular mechanisms,
Mm.
improve metabolism, improve your mitochondrial function, improve waste removal, improve just basic aspects of your physiology. So that to me is pretty much, again, like it's going to help. Yeah. The more
Yeah.
time you spend in there, probably the better. I have clients that sleep in there for several hours a day. A lot more people are putting them in their homes, and I think it's a great tool for recovery. After all of our regenerative medicine procedures, we stick everyone in the hyperbaric chamber. I
Wow.
feel like that accelerates recovery by quite a bit.
What's the? Is it 1.5 or you're doing
No,
like a 2.0?
well, you just really want to get to that 2.0,
Wow.
right? It's kind of the gold standard 2.0. Anything less, you're not getting as good effect. You're just not wasting your time. But these 1.3 atmospheres, like I don't really feel like it's a good bang for the buck. So 2.0
Mm.
is what you should do. Yeah,
Interesting.
yeah,
Going back to some of the peptides you mentioned before, the Cmax and the Selenk, they're two peptides that have, or nasal nootropics that I've covered extensively on my YouTube channel.
yeah.
I love the science behind it. I love the fact that there's no tolerance. It's not habit forming. I
Mm-hmm.
think it has a restorative effect on the GABA receptors.
Mm-hmm.
Um, yeah, what sort of is this something that you've used for quite some time, or is it relatively new modality?
I've been using the basic peptides for quite a while now. So yeah, a good amount of experience with them. Not everyone responds to C-Link and C-Max,
Mm.
but I do have professional athletes that go out and before they play, they always do a little C-Link because it calms you down a little bit, but also gives you focus at the same time. So what are agents out there can do things like that? And so I feel like for certain people, it's very useful. And
Mm.
it's actually one of the mainstays for treating anxiety in our practice. We've used it in IV infusions. I've injected it on the vagus nerve. Obviously, as nasal sprays, we have a nasal spray called Chill the F Out, which contains the C-Lank and P2228. That's people generally like that one quite a bit.
Mm.
Um, yeah, we're just always playing around with different combinations. We have these unique stacks that we've kind of formulated, with technology, right? You're like layering them, putting on different kind of groups on them, making them extended release, encapsulating them with exosomes, enhanced cellular delivery and penetration. So lots of work being done on the peptide front, different
Mm.
delivery mechanisms, whether it's like sublingual or buccal strips or, the pens that you see these days. It's just going to be a lot more user friendly coming out. And I think the stacks are also going to be very important. As in, peptides just need a whole new rebranding exercise. Like,
Yeah,
who the hell knows what CJC 1295 is, right? Like, for the average customer, like you just, you know, a rebranding exercise is needed.
agreed,
Gives you,
agreed.
yeah, yeah,
You mentioned making more user friendly. Obviously, there's a huge subset of the population that does not want to inject, right? Obviously, there's like they're oftentimes fearful. They'd rather use like a topical, like a patch, like a nasal spray.
yeah.
Do you think that like is that an area that you think that we're going to have more, you know, research coming out about, you know, the topical application of certain peptides, like, I mean, copper peptide already, GHKCU is quite effective in that regard already.
Yeah,
But yeah, do you think, is that a concern for clients that they just prefer not to inject, right? Typically.
for sure, for sure. I mean, especially some of these short-acting peptides get injected 5 days a week. Like, how many people are willing to kind of do that? Yeah, listen, I mean, transdermal might be an option. We're looking at a lot of these sublingual formulations. The GLP-1s already exist in sublingual.
Wow.
We have sublingual tirzepatide as a microdosing option. As maybe but I'm kind of a big proponent of microdosing GLP-1s as one of the best longevity tools that we have out there.
Wow.
When you microdose a GLP-1 is a sublingual formulation going to be enough? I'd say probably, okay. And so
Hmm.
that could be a daily option. Just put a few drops in your tongue, and you kind of get that metabolic effect of those GLP-1s. Also, people are developing all sorts of, the sublingual delivery systems and also buccal strips. Okay, strips. You can put strips on your gum and get like 80% of the efficacy of an injection. And so that's obviously, these are game changers that are really going to change the field. The addressable market is going to just multiply by so much when you don't have to stick yourself in a needle.
Yeah,
Yeah.
so that microdosing tirzepatide as a sublingual solution, that's something I've never really come across, but I've heard many experts like yourself say that these microdosing for those that are not super obese, but just for wanting to maintain general health and longevity, using those in replacement of like metformin, um, you think there's more merit to that?
Yeah, yeah, there is. It's just a much more elegant drug. It's a cleaner drug than
Mm.
metformin. That's amongst the longevity docs, metformin's falling a little out of favor.
Yeah,
Although, hey, I still think it's a decent drug.
yeah,
You look at the clinical studies. I mean, actually a few of them just recently came out, just even in 2025, that show that people on metformin like live longer, have a lower all-cause mortality. I mean, it's through the same mechanism, right? Of
yeah,
obviously just, improving your metabolic control, decreasing, making you more insulin sensitive. But GLP-1s do that, and they're just a much cleaner drug. I
yeah.
prefer people take GLP-1s now. Metformin, I put people on far less these days. Um, yeah,
What do you do about the? I know you mentioned the microdosing aspect of tirzepatide, but in terms of the nausea component, do you stack it with anything else to offset that, or it's not really an issue when it's such a low dose?
you just no, you don't get nauseous on these microdoses. And if you
Mm,
get nauseous, it's just you're either taking too much, or there's some people that just cannot tolerate GLP-1s regardless of kind of what doses. But microdosing, usually most people don't even feel it.
yeah,
The way I personally like to microdose is I actually like to push the dosage to a point where people get like a minimal appetite suppression, even if they're not obese and not diabetic. Like, I still want them to take an amount where there are just very small changes to your appetite and satiety and your kind of reward centers in your brain, because it actually promotes just healthier eating, healthier lifestyle, less addictive behavior, less tendency towards alcohol, sweets, nicotine, all sorts of stuff. So beyond its metabolic effects, it's the lifestyle effects that are
mm,
also, not to be overlooked. That's why I like the GLP-1 so much.
yeah. Interesting. What else in terms of like from a fat loss? I mean, you'd have a number of patients, I guess, walking over the years that they want to lose weight um, beyond just the basics, calorie control, exercise, sleep. Maybe their hormones already quite dialed in. Are there any other interesting compounds or interventions you've leveraged over the years?
Yeah, I mean, the commercially available ones would be things like MOTS-C. MOTS-C pairs really well with the GLP-1. Obviously, the growth hormone boosting ones like the CJC, ipamorelin, like that is a very commonly used dual combo, right? Boosting your growth hormone levels can increase your energy expenditure a little bit. I also like 5-amino-1-MQ. That's a really good one. Tesofensine I use sometimes in conjunction. Even just things like low dose naltrexone. It's a completely different system, but they have synergistic effects when you kind of use them with GLP-1s. A little
Mm,
combo that I use is like a 5-amino-1-MQ plus a GLP plus plus a LDN, all right, low dose naltrexone. Maybe I add a little MOTS-C. There's like kind of infinite combos there to use. The new stuff coming out, cagrilintide, is going to be a game changer, right?
yeah,
There's that Cagri semi that's being released. So cagrilintide works on amylin, which is a different kind of pathway there as well. You're going to get like pretty profound kind of more profound weight loss than you can get with a GLP alone, and yeah, pretty safe to use, I'd say.
it does excite me just seeing the advancements in some of these unique mechanisms and these unique pathways. I do find that really exciting, and I guess the advancement of AI is going to help with discovery, like drug discovery and understanding pathways. Like, are you leveraging it or using it yourself in any way, maybe for like research, things like that at all?
Of course, I mean, I for sure use it on day-to-day applications. We always kind of use our thoughts, plug stuff into all the AI programs out there to come up with they can kind of assist with your thinking.
Yeah.
No, I'm not using it to discover new peptides myself. That's very interesting to me. There's 7,000 peptides out there.
Yeah.
Like, where clinically being used, like, so few of them comparatively right now. There are
Mm,
going to be so many more kind of targeted, peptides out that are going to be released soon, and that's going to be very exciting. Yeah,
mm, yeah.
yeah.
Fascinating. Any other, I guess, like, what do you think in terms of stem cells specifically? I mean, that's an area that's shifted quite a lot. I mean, we've seen different types being deployed. What do you think it's going to look like in the next 3 to 5 years? Are there certain types of stem cells that you're excited to see more research on, or is there a one that you want access to that you don't have access to? Like, yeah, where's that going?
This field is also evolving very, very quickly. I mean, back in the days, I mean, here in the US, you're just kind of limited to what you can and cannot do. I mean, there are kind of FDA exemptions where you can use, like, say, culture expanded adipose cells under an FDA exemption now. So that's like exciting, right? You can take a fat sample, culture
Hmm.
expand that, and use that. These days, you can use your hair follicles, right? You can pluck your hair follicles, it can grow out the stem cells and give you your own secretome. These are like your own exosomes, and you can use that, for cosmetic reasons. As of right now, a class of stem cells that I'm personally excited about are these Muse cells, the MUSE cells. You've probably heard of, right, Dr. Khan or other people kind of talking about them. They are multi-lineage differentiating stress enduring cells, pluripotent like stem cells. They can, they have homing mechanisms. They stick around a lot longer. They're smaller than your typical umbilical stem cell. Yeah, I feel like, you can get pretty good results with those. So many different kinds. The umbilical cord stem cells have been around for a little bit now. We know that they're pretty good. Bone marrow derived stem cells. There's a company in Sweden, Celco Labs. They make great stem cells. I mean, there's most stem cells work. Which ones are going to work the best? They're probably
Hmm.
the ones that are really targeted towards your very specific condition. All right, like
Yeah.
neurodegenerative disease, you want cells that are going to be neuronal specific, right?
Yeah.
Yeah. So that, I think, is the future.
In terms of, because I don't know what your plans are with Extension Health. I mean, do you want to let my audience know a little bit about? You've got an incredible, clinic in New York,
Yeah.
but obviously you've expanded beyond that as well.
Yeah, I mean, so we are building a new office right now in Midtown New York City. We're about to, we actually are launch we're launching our membership in the next 2 or 3 months. We've kind of been working on that for a very long time. We've always had just a regular a la carte model, which doesn't really make sense with longevity medicine, right? These are very long-term relationships that we have with patients. Many we've seen for many years now. And so the memberships are kind of launching, and expanding and looking at opportunities in Miami and LA. And so I think the next few years will be pretty growth phases for us.
Mm.
The last thing I'll mention is we're also launching a kind of direct to consumer platform. Okay, it's going to be called Vitara Health, Vitara Health, launching very soon. But the concept is longevity simplified. Longevity can be such a complex topic. Like, what do you take these days? There's, Instagram medicine just telling you to take all different kinds of supplements and this and that. Like, what do we truly believe really moves the needle? And there's going to be some basic things like rapamycin and low dose naltrexone, and like some of the SGLT2s and microdosing tirzepatide, and some of the basic kind of peptide creams and nasal sprays and things like that don't involve needles, that don't involve extensive medical consults, don't involve blood work, just longevity simplified. So that's going to be out soon. I'm very excited about that. That's Vitara Health. And just I think for us, it's for me, it's never about like, let me try to grow as big as I can. It's more about like, let me try to continue to refine the clinical care that we have here, really deliver just the most high end, well thought out, personalized protocols for individuals. And that's just always been my goal. Always also just to kind of democratize knowledge, let everyone know that these things exist out there. That's what I want to do. I want to work with the best doctors wherever we are. So yes, I am always kind of eager to meet new doctors from all around the world, educate them, and potentially set up partnerships in other countries as well. So yeah,
It's incredible. Keep doing what you're doing, man. This is it's a super exciting space to be in. I mean, you're really on the cutting edge. You're so keen on in showcasing some of these modalities and interventions and treatments that they just don't. Some of them just don't get talked about until a big influencer just makes one post about it, then all of a sudden everyone's jumping into a hyperbaric chamber when you've probably been using it for years. So really, really appreciate what you're doing, and I'll make sure to leave a link to your clinic in the podcast show notes. No plans on expanding to the UAE by any chance, Dubai, or?
I've had many conversations with
Yeah.
people out there, but I gotta focus,
I
right?
know,
Like,
I know.
I'm doing some things really well, and then for sure, as opportunities come up, I'd love to kind of evaluate them.
Yeah.
But yeah, I mean, we know we know so little, so much, but yet so little at the same time.
Mm.
Like, I do have to stress that longevity is very complex. There's no one silver bullet that kind of can fix things. It's a constant learning process. I'm learning from other people all the time, and just stay humble and learn as much as you can.
Yeah, consistent, continuous learning and constant refinement. And I guess you'll just keep evolving and shifting your protocols, interventions,
Exactly.
treatments based upon the latest science. So really appreciate you coming on the podcast today, Jonathann. If people want to connect with you, you've got an Instagram page. I'll leave that linked in the
Yeah,
podcast show
just
notes.
Dr. Kuo on Instagram, and Extension Health on Instagram. And feel free to contact us, leave us any questions. I'm happy to share my knowledge as always. And it's a great pleasure being here. Yeah.
Awesome. Well, that wraps up today's episode, guys. If you did enjoy the episode, you learned something new, and you're excited to improve your overall health, please leave it a 5-star review. It really does help with the algorithm. That's it from me today, guys. I look forward to seeing you on the next episode.